The sound is not coming actually.
Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank Universe for giving us this great opportunity. And Dr. Shweta Singh, our Chief Administrator, will start the session.
Hello everyone, myself Dr. Deepika Balani, CA volunteer, welcomes our respected speaker, Dr. Shweta ma'am, and our chairman and CEO, Kavita ma'am, all the CA volunteers, and all the attendees to our CA webinar. I would like to take the opportunity to introduce CA Homeopathic Study Group to all of you. CA Homeopathic Study Group Pro Bono was organized and founded by homeopath and humanitarian Dr. Kavita Kukunur ma'am, who is the president and CEO of Kavita Holistic Approach, KA. This group is intended to be offering from Kavita ma'am to the homeopaths around the globe, sharing goodwill and solid clinical work with the classical model as foundational principles for the KA. KA's mission and vision are very unique: to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy and provide professional continuing education and homeopathic credits for the practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Coven Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She's a nationally board certified by Council of Homeopathic Certification CHC and Achina CPD provider and serves as an associate editor for the Homeopathic Heritage. She's also a NASH mentor for North American Society of Homeopaths and lifetime member of NCH, National Center for Homeopathy. She's also the recipient of Martha Allman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. TANA, Telugu Association of Northern America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita has received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA Mr. Harbhajan Singh Cheema, and ex-director of Homeopathy, Government of Uttarakhand, and chairman of Homeocure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future, at Kashipur on 21st August 2022. Dr. Rajneesh Sharma sir, our CA advisor, and Dr. Shweta Singh ma'am, our chief administrator. CA team were also recognized and presented with Legendary Homeopath Award at the ceremony. We are proud to announce that Dr. Kavita was honored as a Woman of the Year 2023 from the prestigious organization of NATA, North American Telugu Association from USA. Dr. Kavita ma'am was also honored by DTA, Detroit Telugu Association Executive Committee, on Mother's Day at Michigan, USA, with DTA Community Service Award 2023. She also received Lifetime Achievement Award in 2023 by Homeocure and Research Institute Director Dr. Rajneesh Kumar Sharma, CA Homeopathic Study Group, Coven Friendly Foundation, in presence of Chief Guest Dr. Shripad Hegde. And she also received Best Wishes from Homeopathy 360. We are extremely happy and proud that we celebrated 13 years of her book, Beyond the Limits, A Challenge to Prove Oneself, and her second book, A Dose of Spirituality with Dr. Kavita, will be completing 3 years on 22nd Jan, which was launched in the presence of honorable guest speakers, American Institute of Homeopathy, AIH President Dr. Alex Becker, and Council of Homeopathy, CHC President Dr. Sheetal Tiwari at our CA webinar. At CA's second annual celebration, our honorable guest of speaker, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have also donated over $1,500 to 10 to 15 charities, which were also listed on our website. Dr. Kavita donated the proceedings of the book through KHA study group platforms to various charitable organizations and homeopathic associations. To name a few, are Coven Friendly Foundation, CHC, DHMA, JSPS College, VT Seva, NCH, etc. Interested ones can reach us for details at kstudygroup@gmail.com. As of now, we have over 500 recordings on professional webinars related to homeopathy. Health-related topics and inspirational talks are also available on our channel, Kavita Kukunur. This webinar is moderated by Ka family and myself. It is being recorded as we speak. We will take questions in the end of the webinar. Also, in the end of the webinar, we will provide you instructions on how to get the certificate. Now, before we start the scientific session, I would invite Dr. Richa Panwar ma'am to read the Code of Ethics.
Thank you, Dr. Deepika. It's my privilege to be a KHA volunteer. Can you hear me?
Yes, ma'am, you're audible. Please allow me to share a screen in a second.
Yeah.
Please let me know if it's visible.
Yeah, it is. Thank you,
Sure,
Dr. Deepika. It's my privilege to be a KHA volunteer, and today I'm very much obliged to get this opportunity and read Code of Ethics for KHA. KHA Homeopathy Study Group Pro Bono Ethics and Benefits. To be a KHA speaker needs at least 1 to 2 months of active volunteering. Only KHA speakers' themes are promoted in newsletters and webinars. KHA provides volunteering for 2 to 12 months, respect and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to WhatsApp group. Articles of volunteers will be posted on KHA website and newsletters and will be sent for publication at other journals too. Volunteers and speakers are eligible for prestigious KHA annual awards. Volunteers are eligible for KHA inspirational talks. Volunteers are eligible for case discussions. KHA promotes homeopathic organization as well as their mega events. KHA promotes great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. KHA maintains a healthy and happy environment, so keeps only like-minded folks. KHA requests everyone to maintain a confidentiality of the group. For more info, you can visit the website www.kavitakhomeo.com. Thank you.
Thank you so much, ma'am. Now, let's welcome our honorable speaker and let me introduce her to all of you. Today, we have with us Dr. Shweta Singh, ma'am, who is also our KHA Chief Administrator. Dr. Shweta Singh, ma'am, is MD in homeopathy and also a PhD scholar. She is working as a research associate in Central Council for Research in Homeopathy headquarters in New Delhi. She is also a senior consultant with Orbit Clinics. She brings with her the rich experience of more than 10 years and expertise in treating many difficult cases. She is a graduate from Baxen Homeopathic Medical College, Delhi NCR, and has completed her MD in homeopathy from Sri Guru Nanak Dev Homeopathic Medical University and Hospital from Ludhiana. She has also completed a postgraduate diploma in health promotion from National Institute of Health and Family Welfare in New Delhi and is currently pursuing her PhD in homeopathy from a reputed university. President of Delhi Homeopathic Medical Association, and she was the first female president of this association, which was founded in 1932 by Dr. Yudhvir Singh, the first health minister of India. She's also the chief administrator of KHA Homeopathy Study Group USA and is a chief editor of biannual newsletter Exploring Homeopathy, which is an initiative by Orbit Clinics. She's also an executive editor of the Hanumanin Homeopathic Sandesh, an online peer-reviewed journal by Delhi Homeopathic Medical Association. Also, she's an associate editor of the Homeopathic Heritage published by BGen. She has also worked as medical officer at Muskan Foundation in the field of drug de-addiction. She's also worked in the post of assistant professor in the Department of Organon of Medicine and Homeopathic Philosophy from a reputed medical college. She has also received many awards and recently has been awarded with Legendary Homeopath Award from the Health Minister of Uttarakhand, Shri Dhan Singh Rawat sir on 21st August 2022 in the first National Homeopathic Conference in Uttarakhand and Ka Hahnemann Award in 2023. She will be speaking on the topic Homeopathic Insights into Dermatological Cases. We welcome Dr. Shweta ma'am to Ka platform.
Thank you, Dr. Deepika, for this beautiful introduction and welcome. I really want to thank Dr. Kavita for giving me this opportunity to share my little knowledge with all of you. Let me share my screen first.
Ma'am, please also take up the disclaimer before the
Yes, I
presentation.
will.
Thank you
Sure.
so much.
Is it visible? Okay. So today my topic is homeopathic insights into dermatological cases. Car disclaimer. All the car homeopathy study group webinars are for educational purposes only and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars. The opinions expressed by speakers, moderators, and attendees are part of the educational experience and do not necessarily represent the position of the Kavita Holistic Approach, KA, or KA Homeopathy Study Group pro bono. So, homeopathic insights into dermatological cases. First of all, the homeopathic view of skin diseases. So, skin diseases basically are the outward expression of what is going on inside. So, you are seeing the skin problems outside on the surface, but actually they are the expression of inside or internal disharmony. They are the reflection of internal dyscrasia, internal disease, or disharmony, or diseased vital force, according to Organon of Medicine or according to Dr. Henneman. The skin basically serves as a mirror which reflects the condition of various internal vital organs. Skin diseases are not simple skin problem, but are the result of underlying internal disorder. They are the dynamic disease that appear on the surface of the body, but remember, the cause is always within. The cause is always inside the body, within the vital organs. Local maladies. You are seeing the skin problems on the surface, but they are not local maladies or they are not local diseases. According to homeopathy, according to Dr. Henneman, no disease can be local, but they are the outward expression of inward and spiritual imbalanced force, vital force. And therefore, the treatment should not be superficial or should not be local, but the patient with the skin disease is to be treated as a whole. We should not treat only the skin lesion or the parts which are affected or the organs or the systems or by the disease name. Like if it is psoriasis, then the medicine should be this, and if it is urticaria or eczema, the medicine should be this. There are no such treatments. We have to treat the patient as a whole. Then the constitutional treatment or the anti-miasmatic treatment is the only way for radical cure. And any attempt to alter this superficial expression or this outward expression artificially is necessarily an act of dishonesty. So if we treat this outward expression of disease with any palliative treatment or we treat it with any ointments or local treatment, then it will definitely harm you more and the disease will grow worse. In the same way, the disease can recur in more intensified way, or it will transform into some other more worsen kind of disease. So such treatment should be avoided in skin cases. Now the case taking. Homeopathic case taking is basically a process through which we get to know our patient or their sickness as a whole in every aspect, so that we can treat our patient in a very rational or judicious way. The aim of case taking is basically to individualize a patient, to diagnose pathologically, or for therapeutic diagnosis, to find out a remedy. That is why we do such a long case taking. We inquire about the pathological signs and symptoms. Along with that, we inquire about the physical generals, the mental or social symptoms of the patient, just for individualization. These questions seems to be very weird. Sometimes it could be very unique, interesting, or useless to our patient, but it is necessary just to individualize our patient. Because in aphorism 82, Dr. Henneman wrote that no real cure can take place without a strict particular treatment. That means that individual treatment of each case of the disease. So individualization is basically is the process through which we could differentiate one patient from another suffering from one same disease, skin condition, and we have to individualize that case, that patient from another by some exclusive features in order to find out the simillimum. These exclusive features can be hidden in the modalities. It could be hidden in the physical generals, in the appetite, thirst, desire, perspiration, thermals, or in the mental generals, or in any sign the patient show up. So basically, we follow this process in homeopathic case taking. And cure. What is real cure? It seems to be like simple at first, like just disappearance of symptoms. But real cure is much deeper from the point of view of organon. This real cure means the change made by the most similar remedy, not only eradicating the symptoms which the patient presents, but the effect will reach to the core of the patient, to his or her body's own healing energy, strengthening and balancing it. Not only the specific symptoms will disappear, but entire spiritual, mental, emotional, physical being is restored to natural health or natural state. So this is the real cure which could be achieved by homeopathy, and this is the beauty of homeopathy. Now, aphorism 153, we talk about the search of homeopathic specific remedy. So there are no specific remedies in homeopathy, but there are specific remedies for every specific individual, not specified to disease condition. So specific remedies to specific individual who is suffering. We have to find out the more striking, singular, uncommon, and peculiar characteristics, signs, and symptoms of the case of disease. And these symptoms are the chiefly and most solely to be kept in view to find out the simillimum. These characteristic symptoms are hidden in the minute peculiarities of the case history. And we as a homeopaths need to possess such skills, such qualities to find out these exclusive features, these characteristic symptoms, striking symptoms, uncommon symptoms from our patient. Therefore, this is why homeopathic case taking is not a mechanical process. It is known as art. So this is the art a homeopath should possess. If the symptoms are more general and if they are more undefined, they are of no use. They can only help you in the diagnosis of the disease. So we have to give importance to the uncommon peculiar symptoms in a case. Common symptoms, they only guide you to the diagnosis, and they are present in every disease or they are present in every drug. So in the therapeutic diagnosis, the common symptoms are of no help. We need to find out these striking, singular, uncommon, peculiar characteristic symptoms of the case if we want to find out the most similar remedy for the case. Now, the selection of simillimum. Simillimum, the most similar remedy. In homeopathy, we do not give symptomatic treatment on the basis of one symptom. Like if this is eczema, we give this remedy. No, we don't give symptomatic treatment. In homeopathy, we provide symptomatological treatment that is based on the totality of the symptoms. The totality of the symptoms, which is not quantitative. We do not give medicine on the basis of what is the count of symptoms you have taken. No. It is a qualitative totality. It is an aggregate of all the characteristic, uncommon, peculiar symptoms arranged in a philosophical way. And those symptoms, that totality, should represent the individual picture of the disease as a whole. That forms a totality. Aphorism 7. In every disease, this is about exciting or maintaining cause, that is causa occasionalis. So in every disease, we should remove the exciting and maintaining cause of the disease first. After the removal of those exciting or maintaining cause, we could find out the clear picture of the disease, which is reflected by the affection of vital force. In some cases, we do realize that the symptoms disappeared only by only by the management. We advise, we do not need to give patients the remedies. We advise them to maintain this thing or to do not do this thing, and then only they recover. They do not need any medicine. Why? Because they are the cases where there is some exciting cause, there is some maintaining cause. It is a pseudo disease. That is not a real disease, real miasmatic disease. So in those cases, only the management works. But in real miasmatic diseases, we have to give remedies, homeopathic remedies, on the basis of the totality of the symptoms. What forms the totality? It is the signs and symptoms, the pathological signs and symptoms, the location of disease, the morphology of disease, the physical characteristics of the patient, the mental, emotional, social characteristics of the patient, the family history, past history of the patient, the treatment history, that everything we ask in a case taking, homeopathic case taking, that forms the totality of that individual who is suffering, and that will lead you to the most similar remedy, the similar, which can help you to recover that patient from his or her suffering. Now, in skin diseases, external application, Dr. Henneman wrote that it may seem as if cure process of a local disease or a skin disease could be accelerated with correctly chosen homeopathic remedy, internally as well as externally, selected on the basis of totality of the symptoms. Or it may seem that it produces a more rapid improvement when we give correctly chosen homeopathic remedy internally as well as externally. But he says no to the external application because it is neither beneficial in acute diseases of rapid growth nor in those of long standing to use a remedy externally as local application to the disease part, even if the medicines were specific and curative in that form. So Dr. Henneman condemned the use of the correct similar remedy externally. We should give the remedies only in the internal, in the form of internal doses. Because external application can cause premature disappearance of local symptoms. So you might stop the treatment before and the disease is present, or there could be a retrograde change, and it is difficult to assess the disease being totally exterminated. So we should avoid external treatment in skin cases. There are few exceptions where we can give external treatment. These are only in the cases where it is difficult to give the medicine by mouth. So in those cases, olfaction and inhalation is more efficacious. Now let's discuss a few cases. This is a case of psoriasis. A 7 years old boy came with her mother for homeopathic consultation in this October 2024. Presented with psoriasis with a lot of scaling, you can see in the pictures, and there was itching which aggravated at night and after bathing, and the patient got amelioration by cold air, by remaining in AC, and he was on allopathic treatment since April 2024, but it is of no use. It was without relief. So these are the pictures which I have taken in October 2024. Associated complaints with this psoriasis were dribbling of saliva during sleep, pain in multiple joints, and brittle nails. So psoriasis, there is a complication which the psoriasis also involves nails, right? Now in the physical generals, this 7-year-old boy has an extreme appetite. He cannot tolerate hunger. He also has urinary infection, cystitis. He has frequent urging for urine and he passes urine in drops. He has to strain for urination. There was no pain, but the urine was offensive. The thirst was extreme with dryness of mouth. He has desire for sweets, indigestible things like pica, rubber, and paper. The patient was hot in thermals, and he has increased perspiration, more over scalp. Stool was also frequent, like 4 to 5 times in a day. He has to rush to the closet in the morning and every time when he eats. In the mental journals, he was very irritable on slightest trifles. He throws things in anger. There was fear of injections, fear of dark. He talks in sleep. And according to her mother, he is forgetful and he has weakness of memory. He also has aversion to bathing. With this, I form this totality. There is psoriasis, extreme appetite, intolerance of hunger, frequent urging to urination in drops, offensive, extreme thirst, desire for sweets, thermals hot, perspiration increase, more over scalp, stool 4 to 5 times in a day, has to rush to closet, irritable, anger, aggravation, contradiction, toxin sleep, forgetful, weakness of memory, and aversion to bathing. And he was on allopathic treatment for for a lot of since April. On the basis of this totality, I repertorized the case, and these are the remedies which came. The case is very clear cut. After a lot of allopathic treatment, there was no relief, and desire for sweets, aversion to bathing, psoriasis, uh, and many other symptoms. So hot patient. So I selected sulfur in that particular case for the first uh, prescription. As a first prescription, I gave sulfur 30, one dose to that boy. But in the follow-up, there was no relief in anything, and the itching and scaling increased. So in that case, I re-evaluated the case, and some more symptoms came up, like there is blocked nose, which aggravate during night. And I made one observation, that is the fan-like motion of his LNSI. वो continuous था, constant था. Then the patient, the boy, was very headstrong. He has anger, aggravation, contradiction. He was very shy and timid when outside, when in school, or when in front of me. But he was very dominating at his home. He was very dominating uh, over towards his parents, though he was very cowardice. So with this observation, fan-like motion of LNSI, there are only 3 remedies. Can you name those remedies? Anyone?
Lycopodium.
Lycopodium.
Or there are 3 remedies.
There's also phosphorus inside.
Yes. Lycopodium, phosphorus, and calibrome. So if we see our repertorization chart, so the next second highest remedy is lycopodium. And with these re-evaluation of case, we see blocked nose, fan-like motion of LNSI, headstrong child. The child is shy and timid outside, but very dominating inside when in his familiar conditions. The patient was hot. There were desire for sweets, and there were urinary and gastrointestinal symptoms. for which lycopodium is the best suited remedy. So my next prescription was lycopodium 200 single dose followed by sacrum lactis 30 TDS for next 20 days. And in the next 20 days, itching relieved a little and scaling increased. But the stool, it reduced to 2 to 3 times a day, which was 4 to 5 times a day earlier. Urinary complaints were also a little better. So I jump up to the next potency, that is lycopodium 1 mg, 1 dose. I gave these high potencies because this prescription is made up on the mental symptoms which that little boy presents. So I gave up in the high potency lycopodium 1 mg. Then after some few follow-ups in next 1 month, you can see the results. This is with lycopodium 1 mg single dose, and his skin is clear. He came to me in October, and then in the following months, winters were approaching. And to my amaze, he never get any aggravation in winters. His skin just cleared up with lycopodium 1 mg single dose. And he is fine till date. There were no recurrence of any eruptions. Let's discuss the second case. This is a case of papilloma breast. You can see there is a wart-like eruption on the breast. A female patient who is a housewife, aged 30 years, obese, was presented with an outgrowth on her left breast. As you can see, the location was on left breast areola. Description: wart-like growth, fluid filled. It is a pea-sized wart hanging with a stalk, pedunculated, as you can see in the picture. Sensation: there was some pain. It was painful. On repertorizing on the basis of morphology of that wart, it was large, it was pedunculated, it was painful, and it was soft in character. So these are the remedies which came up on repertorization. But the patient, if we go into the history, the patient was markedly anxious about her health. She was my patient since long. When I was working in a charitable dispensary. So she used to come up to me to check if there is some lump in the breast. And she was coming to me for the past 2 years. In every 2-3 months or 5 months, she came back to me to ask me to check my breast if there is any lump. There was a history of her friend had cancer, breast cancer. So she has that fear that it can happen to me. So she keep checking for that. She even went for mammography, which was found normal a year back, but that anxiety, it remains the same. So this is very important to me, and because I know her from the last 2-3 years, so that symptom, I took it for eliminating symptom, anxiety health about. And there was, if you see the previous symptoms, nitric acid covering every rubric. And in the anxiety, this is the only remedy which came in common. So I prescribed acid nitricum 30 single dose to her, and you can see the prog. This is the repertorization chart, and you can see the progress. Day 1, this is the what. On day 3, this is the condition after nitric acid 30. Day 7, and you can see on the day 15th, there was no what. The third case, this is a case of Meibomian cyst. This is a male patient of 38 years who is very tall, fair complexioned, and he consulted me in January 2020 for, you can see, chalazion. Meibomian cyst is basically also known as chalazion, and it is a painless, hard, nodular swelling, which may be unilateral or bilateral, present on upper and lower eyelids since 1 year. This patient had undergone surgery multiple times for this. In the past history, he was diagnosed with left-sided renal stones, for which he took homeopathic treatment in the past. I also asked him to check his blood sugar levels, which was also found to be within normal limits. In the physical and mental generals, there was nothing peculiar in the physical generals. And but the patient was very irritable. Every little thing offends him, and he's very quarrelsome. He likes to travel a lot to different places. That is the only thing I got in this case. So I made this totality painless, hard, nodular swelling bilaterally present on upper and lower eyelids, which is recurrent in nature. The patient was quarrelsome, angry, or irritable, and desired to travel. This is the repertory chart. And as we all know, a very common remedy for recurrent styes, we know, but for this Meibomian cyst, staff came up to the as a highest grade remedy. I gave Staphylococcus 200 single dose, followed by Rubramid 30, 3 times a day for 15 days. But this is not a very easy case that I gave only Staph 201 dose and it recovered, or these Meibomian cyst disappear. No, it take a lot of time. I jump into the highest remedies up to 10M. I have to give staff 10M, till staff 10M. And there were recurrency, but the intensity goes down and the duration of recurrence, that also got prolonged. And after staff 10M, this is the follow-up picture I have. So basically, in modern medicine, there is no treatment for such cases, such conditions, such Meibomian cysts. They only have corticosteroids with them. They only have the option of incision or curettage, which can lead to permanent damage to Meibomian glands, which can cause dry eyes or ocular irritation. But with homeopathy, there is no such side effects. We have a very safe treatment. We are doing this recovery with the sweet pills. This is one more case of atopic dermatitis. So this is a 8 months or 6 months old baby. Sorry for the description, that is wrongly placed. This is a case of 6 or 8 months baby who came up with this condition with her mother. As you can see, there are moist skin eruptions. There is serous exudation, which is very copious. You can see the condition of the skin in the picture. There is thick leather-like crust under which thick and white pus collects here and there. You can see hairs are glued and matted together. And these eruptions appear after vaccination. So anybody who can guess the remedy?
Puja, Silesia.
No. With this description, which I have wrote, these are the indication for the remedy. We don't need to repertorize this case. Only looking at the skin, we can, prescribe remedy. Keynote prescribing.
Miserium.
Yeah, very nice. So I have given Miserium 30 in this case, single dose, and you can see the results. This is before and this is after. Just in 5 days with Miserium 30. Now the next case. This is a case of granuloma annular actinic. A 62 years old lady. She consulted me in this last year, Feb 2024, for her skin issues, which was named as granuloma annular actinic by a dermatologist. She was suffering from this since 1.5 years, and she got no relief with the modern medicine. This condition is basically a skin condition which is characterized by annular plaque or papular eruptions on sun-exposed areas, which usually affects middle-aged adults. It is a form of granulomatous dermatosis where skin immune system react to sun-damaged elastic tissues. And in modern medicine, there is no specific treatment. There are some topical or intralesional corticosteroids that only they have, or the laser therapy. So she got no relief in the modern medicine, and eruptions were on the exposed areas of her skin without any sensation. They are painless, but it aggravates during summers because of the sunlight or heat. There was burning and redness whenever she get into sunlight, or whenever there is heat around us, or whenever after she exercise, or whenever she is near the stove. In the past history, the patient has amoebic liver abscess, which she got operated in December 2023. She is a beta thalassemia minor patient. You can see in December 2023, she got operated for amoebic liver abscess. So there is some liver issues which can aggravate this skin condition. So internal cause, you can guess what is related to the skin problem. In the physical journals, thirst was normal. There was dryness of mouth. There was desire for salty and spicy things. Stool was 3 to 4 times a day, which is satisfactory. Thermals, hot. She was a hot patient. In the mental journals, she likes music. She has a fear of narrow places, dark places. Totality. This is what we got from the case taking. Eruptions over skin, aggravation summers, aggravation sunlight, heat, salty, spicy desire, hot patient, likes music. And after repertorization, these are the remedies which came up. As she was a hot patient, there was desire for salty, and the top graded remedy coming up was natramune. And there is aggravation by the sunlight, so I prefer to give natramune in this case. Natramune 200 was given in a single dose, followed by sacrum lactis 30 TDS. In the follow-up, eruptions were little better. So I repeated in the next follow-ups, I repeated the medicine in higher potency like natramune 1M. But there was not that I do not get the desired result which we need in the coming follow-ups with natramune. There was recurrence, it is not going, properly. She is recovering, but there was something which is not, she is not recovered fully. So on re-evaluation, one day I saw that her tongue was coated thickly white, and only on the basis of that symptom, with the previous totality, tongue thickly white coated, eruption aggravated by sunlight, I prescribed antimicrobial 30 BD for next 15 days. And with antimicrobial, we got very wonderful results. Now she's free from her problem. You can see her skin. She don't have any skin eruptions now. She is recovered. This is all from my side. Thank you so much. If you have any questions, please go for it.
All of you are requested to please share questions in the chat box if you have any.
Can I ask the question or I have to write in the chat box?
Ma'am, you may.
So, ma'am, I just wanted to know whenever we are giving medicines in skin cases, how long should we wait for the result? Like, is it depending on the intensity or is it depending on the, time? Like in your case, you said that you were not happy with Natromore and the intensity and frequency was not good. So, how do you decide when to give another
I
remedy
think
or increase the dose?
I think this totally depends on experience, and we cannot, in skin cases, we cannot ask our patient to stay quiet for so long. They need results, otherwise they will leave you. So if I am not getting desired results with the high potency also, so then we can, we can re-evaluate the case, or maybe that is not the most similar remedy. So that totally depends upon our discretion. I think we need to rethink. There is no need to, if the remedy is correct, you can get the result in single dose. There is no need to repeat that remedy for so long. So
Okay, so ma'am, 7 days or 10 days is enough.
yeah, the duration of medicine is written in Boric, so we can refer that for the action of remedy. So we can
Okay, ma'am.
wait for
Thank you.
that particular time, and after that we can choose to stay with that remedy or to go with some other, or to increase the potency or something like that.
Okay, ma'am. Thank you so much.
Thank you.
Ma'am, we have one more query in the chat box. Dr. Chiranjeev Dey is asking, what about the results of using LM potency in skin diseases?
Sir, I'm not using LM potency till date, so I can't comment on that. But I got to know from many homeopaths that LM potency gave very good results. And in skin cases, I think it's good to use LM potencies, because they do not have any that aggravation which may be with CH or other.
Thank you so much, ma'am, for the wonderful session. Your presentation was very enriching and we learned a lot from your cases. So,
Thank you so much.
congratulations. I would now like to take this privilege to honor you, ma'am, with our KHA appreciation certificate.
Thank you so much, Dr. Deepika. Thanks
Please
to
accept this.
Community Study Group, to Dr. Kavita, and to all the attendees for your patience listening. Thank you so much.
So
Dr.
thank you
Shweta?
for your gracious presence.
Dr. Shweta? Hello.
Ma'am, we have a query from our attendees.
There's no this form today, the yacht form to be filled up.
No, doctor, you have to please mention your email ID in the chat box, and that with the help of that, we'll be able to provide you the certificates.
Ah, that's okay. That's okay. Fantastic. And my compliments to Dr. Shweta always. Very
Thank you.
nice cases, really, especially the cure of that natrium muriaticum is fantastic. Anyway,
Thank you,
all
sir.
cases were excellent. Thank you very much.
Thank you, sir.
Thank you for your gracious presence and your precious time in sharing your knowledge and wisdom.
Thank
And
you.
heartfelt thanks to our viewers and followers who joined us today. And we have many such informative webinars lined up in the upcoming sessions and with many more renowned homeopaths. Also, for upcoming webinars or info or any other updates, you can follow our social media handles. And if you have missed any webinars, you can also watch it on our YouTube channel, Kavita Kukunur. I am also thankful to all the CAR volunteers for their continuous support and selfless services with which we are able to organize these webinars in a successful manner. For further queries, you can reach us out at carstudygroup@gmail.com. Ma'am, if there are no queries, please permit us to end the webinar for the day.
Yes, please. Thank you. Thank you, everyone.
Thank you, everyone, once again. Thank you so much, ma'am.